Hi, I'm Lynn from Trunamics, and here are 5 stretches that you can use from our comprehensive self-care program that will help you be a pain-free massage therapist. Hey everyone, here at Trunamics we have built a very comprehensive self-care program that I really think is going to help you become a pain-free massage therapist. We all know at work every day how taxing our job can be. So here I wanted to give you 5 stretches from that program that you can use right now that are really going to help you get through your day. Now you can use these as a warm-up to start your day or pick and choose whichever ones of these you want to do in between clients, but they're really going to help you warm up and get ready, okay? So these 5 stretches that I'm going to show you are functional stretches, which means that we're going to take these stretches through all 3 planes of motion to really get your muscles warmed up and lengthen and get your proprioceptors turned on. These are a few stretches I learned while I was at the Gray Institute training, and I wanted to share these with you because they're stuff that I use every day before I'm working with the clients or in between clients. Now we do have comprehensive stretches for all of the body in our main program, but I wanted to give you the few that I use every day. So the first one is the hip flexors. So what you're going to do is internally rotate your foot and step out into a lunge. So we're really going to isolate these hip flexors because most of us are sitting down sometimes in our sessions, whether we're doing neck work, cranial work, reflexology, or any type of seated work, and our hip flexors can get really shut down. I mean, even driving to work is going to get these tight. So it's very important that we decompress these and eccentrically load them. Okay, so once you're in position, make sure you look back and see that your left foot is internally rotated because your proprioceptors might feel like it is internally rotated even when it's straight. So we're going to keep this leg straight the entire time, get into a lunge, and then we're just going to take our hip flexor through 3 planes of motion. So we're just going to start out by bending our front knee and driving that through a little sagittal plane motion. What I recommend is for you guys to hold on to a wall or something as well, like a chair, because that's going to help give you a little bit more support so you can keep your chest up. After you do that motion 10 or 12 times, I want you to really load up the hip flexor and then take it side to side through frontal plane motion. Sometimes it's easy to cheat and just do your shoulders, but keep your shoulders still and get your hips to go side to side and really open that up. This is a really important stretch that hardly anybody ever does in the frontal plane. And then let's take it through the transverse plane. Just kind of do some circles all the way around. Doesn't matter which direction, but that's going to get these guys opened up. Okay, so then we're going to switch to the right side. Just go ahead and internally rotate that right foot. In fact, I would do that first, put it about 30 degrees. Step out into your lunge, keep your chest up, and go ahead and keep your hand on the wall or a chair. And let's just start driving this stretch through the sagittal plane. 10 or 12 times here. And then we're going to stay in that stretch. Let's go side to side. In frontal plane, make sure you're not moving your shoulders, just your pelvis back and forth. And then we're going to go to transverse plane, 10 or 12 times. After you guys get through these stretches, I want you to go for a walk, and you're going to be amazed at how much your gait has changed and how much this decompresses your lumbar spine, because a lot of that compression comes from the front being in flexion. Okay, so next we're going to move on to our glutes. When we're bending over all day like this, our hamstrings and our glutes really get loaded up, holding us up, and I want to show you how to get your glutes to let go. So just take your knee, put it on your massage table, get your foot on the floor straight ahead. Bring your arms down like this, get your chest up, and we're just going to come forward in the sagittal plane and really kind of lower and unload this, get these muscles warmed up. Now this is a pretty common stretch. It could be something new to a lot of you, but it's very effective. But what a lot of people don't do is they don't load up like this and then go into frontal plane motion. And that's very, very important. Because just stretching, doing static stretches without any planes of motion really doesn't do that much, right? That's just going to drive your dysfunction further towards your spine and not really be effective, and it's not going to last. Okay? So let's go ahead and switch legs. We're going to get this knee in front of the belly button, foot on the floor straight ahead, hands in front once again. Just going to go into some sagittal plane motion. Kind of get that loaded up 10 or 12 times, and we're going to stay down. We're gonna take our butt side to side through frontal plane motion. A lot of people don't have any frontal plane motion in their pelvis, and that causes a lot of issues. So now we're just gonna go into some circles, a little transverse plane motion, and really open that up. Now, a lot of us, especially guys that do structural work or deeper tissue work, we use our elbows a lot. And so all of these muscles in your shoulder really get tight and really take a beating, holding that shoulder in place, or the elbow in place as you're working. So what I'm gonna do is just come up to the wall, and I'm gonna take my elbow, place it on the wall, and just step in, and that's gonna create a nice stretch to the posterior deltoid, a little bit of the rotator cuff muscles. I'm not gonna cover that too much here. We do that in our long form video for the whole body comprehensive part. So I'm just gonna take this here. Just going to drive that forward. Once again, I'm going to use some planes of motion here. So I'm going to take my pelvis and really push it forward. And then I'm going to put a little rotation in, which is really going to give me a good stretch along that posterior deltoid. Okay, I'm going to switch up, do the same thing on the other side, get the elbow in there, try and get my shoulder to the wall. Just kind of load it and then get some rotation. That's really going to help open this up and warm it up and get it ready for a lot of elbow work. Now, of course, our forearms, right? They all take a beating. Here's my favorite way to stretch my forearms. I'm going to take my hands on the table like this. I want to notice that my inside of my elbows are facing this way. That's because my flexors are tight from being a therapist for years and years and years. So what I'm going to do is I'm just going to take my elbows and internally rotate them a little bit. Okay, so I'm going to take them out so my elbows are facing away. So that's going to load them up in the transverse plane for those motions. Then I'm just going to go frontal plane back and forth like this, and that's really going to open them up. In fact, I can even go forwards and backwards like this to change that angle from all those lines of fascia running from my forearm up into my shoulders and the rest of my body. So that's really going to help get that opened up. And now I can also do my extensors. I'm just going to show you an easy stretch for this. I will warn you, if you have really tight wrists or that they're sore, I wouldn't do this with a lot of pressure. I'm just going to take my hands and put them down. And then I'm just going to load up the forearms like this, like taking my body away. And then I'm just going to twist my shoulders back and forth and a little side to side. And that's going to help unload some of those deeper lines of fascia to really open that up. So there you see, those are 5 quick stretches that you can do that are really going to help you. You can use these in between clients. You know, sometimes I know if I've done a lot of elbow work working in a lower leg, I might stand up and get my posterior deltoid loosened up just for a few seconds, just to kind of decompress the muscles. And especially I would say the hip flexors. I mean, I do this stretch every day, whether I'm driving, flying, at work, bending over people. We're always in flexion, and that's the best way that you can quickly do that. Just jump up from your table, get in there just for a second, and go walk out to your next client. It really helps to unprogram all those tight muscles, and you're going to notice everything in the back, right? Everything in the back, all that chronic tension is coming from an issue in the front of the body, and these are great stretches to help unlock that. So I hope you guys use these. Let us know how they're working for you. And if you want to have even more of those stretches for pretty much every muscle and everything in the body, you can go to our TruPro Think Tank. That's where we have a very comprehensive self-care protocols where we talk about not only functional stretching from the body, but how that affects structure a little bit and how to work with the energetic concepts. You know, how we're giving away electrons and all the things that really cause a lot of inflammation in our body and really leads to pain. Hope to see you guys there. Thanks for watching.